Hi, I'm Dr. Jason Tirado, your West New York chiropractor, with your back pain update for today. Today we're talking about why is it that my usual back pain stretches don't seem to help my back pain anymore. You know, like most health conditions, low back pain is really a chronic problem. And patients with lower back pain typically suffer on and off for years. It's just the way it is. You know, back pain actually seems to come on when we're overexerting ourselves or we're doing something out of the ordinary, such as maybe moving boxes in a weird way, or when returning to a sport that we haven't tried since our high school days. You know, those weekend warriors out there. You know, most patients say that sometimes stretching seems to prevent problems and injuries from the activities of daily living. So both the weekend warrior and the daily athlete will certainly attest to the benefits of stretching prior to doing some kind of activity. You know, but stretching is actually typically not a good treatment plan when the pain comes on. It's one of the last things you want to do. So why is that? Why is something so effective for preventing a problem and completely useless as a cure? It's a great question. Some patients are lucky, however. Through trial and error, they may find that actually stretching will actually cause their back pain to get better. But over the years, its effectiveness of stretching really begins to diminish. Some patients will say that the normal pre-activity stretches actually make the pain get a lot worse. So, stretching is really designed to lengthen the muscles here and lengthen the tendons. But back problems typically aren't affected, they typically don't affect the ligaments and the discs. And the problem here is that the ligaments are typically stretched out, which allow the bones to creep into these really abnormal positions. So while stretching may help a tight muscle, its effect on the ligaments can actually be no good. It could be detrimental. Another fact to consider is that the delicate nerves of the spine, of the lower spine, that cross right around the disc areas, right? You got to take that into consideration. With stretching, those nerves can actually begin to lengthen and become even more irritated as they get stretched out. So if you find that your normal stretches seem to have absolutely no effect on your pain, or even make the pain a bit worse, then that's typically a sign that some of the ligaments inside your back have been damaged. So stretching typically isn't going to help you in that particular scenario, and you're going to need to consult with a chiropractic doctor who will perform some form of examination of those ligaments and of the disc. Be careful where you go. You know, the adjustments that a chiropractic performs are designed to align the bones and align the spine so that the ligaments don't remain stretched out inside the body and don't continue producing pain. You know, over weeks, the bones begin to hold their normal position for longer periods of time, and gradually the ligaments will begin to shorten inside the spine as they slowly heal more normally and naturally without medicine. You know, our office can also advise you on stretches that'll lengthen the muscles, but don't cause further stretching to the already damaged ligaments of the spine. So, if you do have some problems with your spine, if some of these ligaments or tendons may be overstretched in your spine, don't hesitate to give us a call. I'm Dr. Jason Tirado, and I'll see you soon.